I'm aiming to keep that knee really still. So how to get the right weighting for this? So I want to train my right leg first. So I lift that knee and then I bend my right leg until when I look down, I can't see my toe anymore. My knee's in the way of the toe. Then I bring that back. So I've got about 99% of my weight in this front leg and I'm just resting on my tippy toe back here. And then I'm putting my left hand forward, right hand by my hip, and I'm just getting this turning motion going. So I'm getting the shoulders to turn, I'm grounding through the right leg, and I'm grounding especially through the tripod of the foot. Again, the tripod, center of the heel, knuckle of the big toe, knuckle of the little toe. So that tripod has the weight all the time. Especially with this exercise, we want the weight to stay contacted, this knuckle down. As you do this knuckle I want to lift off the floor. So keep it down. It has a direct connection with pronation in the foot and helping supination too of the foot and the glute on the same side. So as that knuckle stays down, this glute can activate better. So as I'm here doing this motion, I'm feeling those contact points in the feet, body staying vertical, and the head staying center. So we don't want the head turning. Head staying in the center. Often when the body turns, the head wants to turn. It needs to be able to disassociate that. So we get this first. I want your knee not to move at all while you do this. So the knee, it often wants to do this as the body rotates. It means the body can't rotate properly. So the knee stays totally still. I make the motion go through the hip and also the waist, but the knee doesn't move, keeping that ground contact, especially through that big knuckle. Head staying center. Then all it is from here is the cross pattern. So if I start off with so I've got weight in my right leg, left hand is out in front, other one's on the hip. As I turn the waist, as I think about turning the waist, I lift the knee and pull the arms down. So the knees up, big twist, hand to the hip, back down. No motion of this knee. I'm not making the knee go back and forward this way, so I'm not shifting weight. I'm keeping the weight 100%, 100 to 99% weight in the front leg all the time. And we're doing that till it fries. So you feel it fry the muscles in your feet, in the glutes. You may feel the hip flexor work. We're looking at least 20 reps, 20 to 30, even up to 50 reps. And of course, do the other side. You can progress this further is to use an elastic band, tie it off on something immovable, putting the leg through. So it's a vector of force going along this way. It's trying to pull me out this way now to the side. I do everything exactly the same. So I especially want to keep that knuckle of this toe down because it'll want to peel that off. So I come up, get the right weighting, come down, set the body up. And I'm aiming to keep that knee really still. How you can progress this exercise is it's set up exactly the same way. So we lift the knee, bend the knee so you can't see the toe, resting on the tippy toe here. Got that opposite arm out. As I go to do the knee lift, I push through the leg so the leg becomes almost straight. So I'm pushing through this one. It's like you're going to do a jump. So there's an extension through that leg. So I'm in this kind of crouch position here. As I lift the knee, move the arms, turn from here. There's an upward impulse through the top of my head and back down again. So it's called triple flexion. Flexion, 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 triple extension. Extend, extend, extend through the joints. And we're doing this till the body fries again. So we're looking at doing at least about to do 10 reps, get up to 20 to 30, even up to 50 reps. And setting the body up, going from a crouch down position, rising up. And if you want to take it one step further, you raise up on the ball of the foot. So that comes right up as the whole leg extends up. Rest this, going from the crouch down position, rising up onto the ball of the foot. And to take this even further, either a stronger band or we just wind this out further so there's more resistance. So we're really trying to control that leg from excellently rotating. This exercise is really good to do as a warm-up before you go for a walk, go for a run. If you've got foot, ankle, hip issues that you're recovering from, very good to do to help integrate the movement pattern and the joint motion into the rehab exercise you've already done. It combines things really well and gradually it builds up into doing explosive jumps, getting into sprinting, all those kind of things.